Hi everyone, I want to show you this really cool chart here about IV gauges. Now if you're new to IVs, this is going to be an extremely helpful chart for you. So let's just go over a few different things about IVs and the gauge size. This is kind of a weird thing that is done, but the smaller the number, the thicker the needles, and the larger the number, the thinner the needles. So if you're down here at 18, obviously you're going to have a larger needle than the 24. And so let's go through each one of these here in a moment, but I want to mention one other thing, that the gauge sizes are usually going to be color-coded based on the gauge size. Let's jump right into it. Size 24. This is typically going to be used in pediatrics and temporary access. 22, this is often used in med-surg. When I used to be a nurse on the floor before I became a nurse practitioner, I did use this size quite a bit. It was also easy to use it in easily blown veins, so I worked on a renal metabolic unit, and so it was really good for those patients. Also, you can use for IV contrast and some pediatric patients. 20 gauge, that's going to be often you can use for most adults. It's also, a lot of times hospitals will have certain protocols. You may have to have at least a 20 gauge. I think our hospital had to have a 20 gauge for blood products, also CT angiography. 18 gauge, this is typically going to be for traumas, anything where you have to push fluids rapidly, codes, rapid responses. This is super important. You want a large gauge for these, the 18 gauge. You want a large gauge for these patients. And I just want to jump back up to 22. Even though this isn't an absolute, often 22 gauge is going to be in individuals that won't need an IV very long and that are not that ill. Well, I hope this helps, and make sure to subscribe.